Welcome to Late Night Health, the radio show and the video show that cares about the most important part of your life, your health. I'm Mark Alyn, and along with Dr. Greg Celaya, a functional medicine specialist, we're going to take some time and talk about stomach acid and enzymes. Uh, Dr. Celaya, welcome back to Late Night Health.
Hey, Mr. Mark, how you doing today?
I'm doing terrific. Most people suffer from indigestion, maybe not on a regular basis, but once in a while. Is that normal?
Well, it's normal, but I guess that really depends. Normal is not necessarily a good thing, right?
Right.
70 to 80% of people that have tooth decay, it's considered normal, but it's nothing that you really want.
Got it. There was a comedian who once said that when he went into the army, he was in about 2 weeks, and he asked to see a medic. And he went in because he said, "Look, the grumbling in my stomach is gone." It turns out his mother was a terrible cook, and the army food was better and didn't upset his stomach. So my question is what we eat, does that affect our stomach and how our tummy feels all the time?
Oh, absolutely. And in addition to that, one of the big things that we have a problem with is stomach acid. You have so many people that have heartburn or other type of digestive issues, and they're taking different medications to reduce their stomach acid, when in all reality, the problem is not enough acid.
Wow. So how do you go about telling if you have enough stomach acid or too much stomach acid?
Well, there are certain tests that we can do to see what's going on. But you have to understand, you have different valves that go from the esophagus to the stomach, and the stomach to the small intestines, and from the small intestines to the large intestines. And those valves are actuated by acid. So, for example, the esophagus to the stomach, if there's not enough stomach acid, the valve won't be stimulated to close, right? Because they're
Right.
naturally affected that way. And what happens is now we have a reflux of somewhat, so to speak, rotted food that's coming up and burning some of the esophagus. And the same thing goes on for the small intestines to the large intestines, and from the stomach to the small intestines.
Well, we've heard, acid reflux. It's advertised on TV all the time. Are you suggesting that the reflux is actually not acid reflux, but potentially rotting food reflux?
Yeah, it's a combination. There, even though you may not have enough acid, there still is some, but not enough to cause the sphincter to do what it needs to do, to close.
And this
And
is
so
the stomach and intestine sphincter.
the esophagus to the stomach sphincter.
Okay,
So
got it.
those sphincters are affected by stomach acid. And so to speak, you have to understand every enzyme that you produce is affected by stomach acid as well.
Every enzyme?
The digestive enzymes.
Okay, got it.
So with the digestive enzymes, you have amylase, which deals with carbohydrates. You have protease enzymes, which deals with proteins. And you have lipases and even bile that deal with fat. And they're all affected and they're turned on by stomach acid. So if you don't have enough stomach acid, you may not produce the correct enzymes to break down your food as well.
Oh, wow. So that the food sits there and doesn't get absorbed, the nutrients, and it can potentially cause illness.
Well, think about it. First off, the symptoms, you can have cravings for food, fatigue, bloating, belching or burping, gas, heartburn, like we talked about, indigestion, diarrhea, constipation, undigested food in your stools is a big one. Acne or keratosis pilaris. I don't know if you've ever seen women that have little dots and spots in the back of their arms. Usually that's from a digestive issue where they're not digesting the fatty acids. You can have rectal itching, chronic candida, bad nails. The nails are a big indicator of how you're digesting your food. Are they soft? Are they chipping? Are they ridged? I mean, so.
I'm looking at my nails right now. They're hard. I can't tell if they're ridged. They're a little, I just cut them, so they're not long. Uh, what about yellowed nails and super curved nails? I know that that's an indication as well.
Yeah, it depends on the weakness of the nail. Are you digesting the minerals that you need in your food to get the correct information or the correct things to your nails? Right. And there can be a problem. Now, if you have always had a nail issue, there may be some genetics involved, but it's something that is somewhat newer. Yeah, it can be a digestive issue.
And what about the supplements to increase stomach acid?
Well, those, in fact, I have a stomach supplement myself. It's called Digest, which is great because it has a combination of not only acid, but enzymes as well. And it works great. In fact, most all my patients over 50, I suggest it to them because as you grow older, the acidic environment or the acidic production from those cells in your stomach tend to reduce. And in addition to that, they also produce stomach acid, but they also produce intrinsic factor. And intrinsic factor is something that's important to have B12 be absorbed into your system. So if there's a problem with stomach cells, the parietal cells, you're going to have a problem with B12 as well.
B12 absorption.
Correct. Yes. And, B12 absorption can affect everything. And the most common that people know of is anemia.
Wow. Let's talk about the digest. When I get to 50, I'll ask you for some,
There you go.
right? Um, but how do I know that I need it or not? Is it is there a test for something like this?
Sure, there are tests, but it's just simple as to try it. Usually, people have different type of symptoms, and some people may not. Like I said, over 50, I just really put people on them. We can do the tests. You can actually save the money by not necessarily doing the tests, but it's great. And so we'll start off at one pill. We'll start off and increase it and see how your body does until you have a problem. Then we back down.
One of the things that I love is fresh papaya. And I know that in a lot of digestive supplements, there's papaya. What about eating raw papaya or fresh papaya?
Yeah, that's good. It's a good digestive enzymes, but it's not everything. You have to have the whole combination, and it really starts with HCl or stomach acid.
And what about um, eating acidic foods versus non-acidic foods? Does that have anything to do with digestion at all?
Well, of course, if you eat foods that are a little bit acidic, like we were talking about apple cider vinegar. Apple cider
Right.
vinegar has a pH of about 2.5 to 3. Your stomach acid is much less, but it may help stimulate the stomach to produce acid.
But eating things like pickled foods, tomatoes, and things that tend to be acidic, would that help as well?
Absolutely, and eating the right foods does make a difference. But there you can have ulcers. You can have different types of ulcers, and the way we look at ulcers is we treat it a certain way. For example, I'll have a patient do bone broth, aloe, uh, slippery elm, DGL, glutamine, enzymes with food. I mean, there's certain things that you have to do to make sure that you're doing well. And eventually we get to subsidizing with HCl or stomach acid.
30, 40 years ago, if you had an ulcer, they would give you dairy. They'd give you milk, tell you to drink a lot of milk and stay away from acidic foods.
Well, they still do the same thing today.
No
Um,
way.
but you have to understand also, HCl sterilizes and activates the enzymes, but it also helps, like I said, sterilize your system. Your digestive system is really a tube that is contiguous from the outside of your body all the way through. So your digestive system is really outside of your body if you think about it.
And you said you're saying HCl. Is that not hydrochloric acid?
Right, it's stomach acid. And so if you don't have proper amounts of HCl, you're not going to sterilize all the bad bugs coming into your system. And therefore, you're going to have a problem. Does that make
Wow.
sense?
Yeah, no, it does make sense. I never thought of that. I remember using a few weeks ago, we talked about mercury. In that same class, we got to play with, we talked about mercury in a science class, and we both had the same experience of touching mercury and playing with it and all that. But that was years ago. You kids aren't subjected to mercury anymore. But in that same class, we got to play with hydrochloric acid, and you take a beaker full and drop paper in it, and it'll burn. You put metal in it, it dissolves. Right?
Pretty amazing stuff, isn't it?
It really is very powerful.
Yeah, and it's like I said, it's not only there to help digest some of the food, it's there to activate the rest of the digestive process. And if you don't have the correct digestive process, you're not going to nourish the microbiome like we talked about before, and you're going to end up with other issues. So one of the big fixes that I suggest for patients is the first thing you have to understand is that your parasympathetic nervous system helps lower pH. So you have to rest while you're eating. Eating on the run is a real problem because you create those problems, right? Those digestive issues. You have to make sure to chew. I have to make sure to be hydrated. And by hydrated, I mean all the time. And make sure that you don't consume fluids while eating because you dilute the HCl, the acid.
So before you eat or after you eat, you should drink?
Well, you have to stay hydrated on a regular basis, not just when you're consuming food, but you would want to stay away from fluids before, during, and after eating as much as you possibly can, right? Because you don't want to dilute the digestive process, which you do when you consume fluids.
That makes sense. What about enzymes? Do you recommend supplements with enzymes that help with digestion?
Absolutely. Like I mentioned, my product has HCl and enzymes in it. And for most people, it works out great. There's some people that are very sensitive to acid and will have to break out the acid from the enzymes, but without a doubt, I mean, think about everything that could be affected by lack of digestion. We're talking about everything, right? No enzymes, you don't digest, you don't break down neurotransmitters, you have mood, anxiety problems. You don't have cholesterol, so you're not forming hormones. You're not breaking down fat, so you have a problem with fat issues as well and hormones. You have inflammation, increased blood pressure because you're not working with those minerals. You have anemia. I mean, you can see where this can go. Everything.
Well, I'm sorry. That's why they say gut health is the beginning and end of all health.
It's everything. If you don't start there, you're wasting your time.
Well, on your website, you have many articles, and I know that you've talked about gut health. We're going to have this video at drcelaya.com. That's drcelaya.com. We'll also have it at latenighthealth.com, latenighthealth.com. And I'll have it on Facebook and Twitter and LinkedIn as well. So if you have any questions for Dr. Celaya, you should go to the website, drcelaya.com. He'll give you a free consultation right over the phone or via the internet, Skype, or one of the other tools that can be used for a conference. Dr. Celaya, thank you very much, and we'll see you next week.
See you next time, Mark. Thanks.
All right. I'm Mark Alyn. Thanks for watching. We'll see you next time. Bye-bye for now.